Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
Now, amid a dispute over the accuracy of government death statistics, are all Covid-19 related deaths even being recorded? This week we reported allegations from an official deeply involved in death registrations in the south of England who claimed that coronavirus was sometimes being left off the records of non-hospital deaths, even if it was suspected. Tonight, a GP has told this programme that they are aware of doctors who are not attributing the virus to deaths outside hospitals, even though they strongly suspect it. Our Scotland correspondent Kieran Jenkins has more.
She was very independent and very proper, and she was very dignified, sort of didn't like imposing on people and things. You know, they said it would take the old really easily. You know, it comes home to you like that it takes your mum. It really, really hurts.
Jill Flux was exactly the sort of person society is trying to shield from this virus. She'd previously had lung cancer and, aged 76, was recently diagnosed with terminal pancreatic cancer.
They weren't expecting her to pass away immediately at that point?
Oh, no. She wasn't that ill.
Jill and her son Toby hoped she still had many months left to live.
Did you believe right away that it was coronavirus that killed her?
Well, I went to see my mother's body straight away on being informed, and was given, you know, sort of paper mask, gown, gloves. It was pretty clear to me that it was likely.
Jill's death in a West Sussex hospice was recorded as pancreatic cancer. Although she was tested for coronavirus before she died, the results only appear to have come back after her death was certified by a doctor. She had tested positive. There is no mention of Covid-19 on Jill's death certificate, although the paperwork completed by the doctor did indicate there may later be more information.
Hi there, do have a seat. Thank you.
Testing should make certifying deaths far more straightforward for GPs.
You open your mouth for me, say ah.
But there isn't widespread testing, so GPs are being asked to use their own judgment in extremely challenging circumstances. Earlier this week, we revealed allegations from someone deeply involved in the registration of deaths in an area in the south of England that coronavirus or suspected coronavirus was sometimes being left off the certification of non-hospital deaths by GPs in favour of other conditions. And they believed these deaths would therefore never be recorded in any official figures. Well, tonight we can reveal a GP whistleblower who also alleges that coronavirus or suspected coronavirus is being left off the paperwork that doctors produce alongside the deaths of some elderly people in care homes. The GP from the southeast of England told us, "I know GPs writing bronchopneumonia or frailty of old age on death certificates when they strongly suspect COVID to avoid running into problems." Well, the GP told us doctors were drowning in work, very stressed, dealing with patients who'd been stable for years, suddenly becoming unwell. And because of a lack of testing, there was high anxiety about what to do after a death. This GP told us that they insisted on mentioning COVID-19 in the paperwork where it was suspected, but that often meant administrative delays and complications. The GP said, "I can imagine a lot of GPs will just put another cause of death to smooth up the situation so you don't have endless calls back with coroners and funeral homes." But they said, "I think if you don't document the cause of death as presumed COVID, it's the final insult really. The patient has died from this pandemic and their numbers are not going to be included." We asked the GP, "Do you think that's happening?" They replied, "Yes, oh yes, absolutely no doubt about it."
Being properly recorded.
England's chief medical officer on Monday said this.
Obviously, everybody who sadly dies the doctor will make an assessment based on her or his view about what the cause of death is. That's what the death certificate says in all cases, and doctors take it very seriously and try to make sure that they get as much information to give accurate data.
Tonight, we've heard from a Scottish care home who alleged that 2 residents died untested with symptoms. but coronavirus or suspected coronavirus was not recorded alongside their deaths, and it seems they will not be included in any official death toll.